Welcome to our Advanced Nutrition Care Training module. This training module builds on our food care introduction training and in particular the cost of malnutrition. The focus of this training is preventing malnutrition. In this training, you will learn about screening and care plan development, food and fluid fortification, problems with eating and swallowing, and mealtime assistance. All of this will help you to provide better care for the people you look after. So let's get into it. Screening, assessment, and care plan development are important aspects of caring for older people and others in need of support. In this section, we will talk about the importance of weight monitoring, nutrition risk screening tools, nutrition care plans, dietary interventions, and oral nutrition supplements. Regular weighing and monitoring is strongly recommended for those who are malnourished or who are at risk of malnutrition. Make sure your scales are calibrated regularly so you can be certain that weights are accurate. Nutrition risk screening tools can help to identify at-risk patients and develop the right care plans for them. At-risk patients who initially screen as having normal nutrition status should be rescreened every 3 months, so malnutrition risk can be identified and treated as early as possible. There are many nutrition screening tools. Two that are commonly used in New Zealand are the short form of the Mini Nutritional Assessment, MNASF, and the Malnutrition Universal Screening Tool, MUST. Let's take a closer look at both of them. The MNASF provides a simple and quick method of identifying elderly persons who are at risk of malnutrition or who are already malnourished. It can identify if someone is at risk of malnutrition before severe changes in weight or serum protein levels occur. The MNASF was developed by Nestlé and leading international geriatricians and remains one of the few validated screening tools for the elderly. This screening tool has 7 questions which are simple to complete. Once completed, the final scores will indicate if the resident is at normal nutrition status, at risk of malnutrition, or is malnourished. The tool and clinician guidelines are available free online. You can find a link in the resources section below this video. Once you've completed the assessment for a resident, it is important to know what the different MNASF scores mean. Scores above 11 indicate the person has normal nutrition status and no urgent diet changes are required. However, it's important to rescreen residents every 3 months to make sure that any changes in nutrition status are recognised early. Scores between 8 and 11 indicate the person has malnutrition risk and requires a care plan for a high energy, high protein diet. Scores of 7 or below indicate the person is malnourished and an assessment by a registered dietitian is strongly recommended. A personalised care plan should be developed based on the results of a comprehensive assessment. The Malnutrition Universal Screening Tool, MUST, is a 5-step screening tool to identify adults who are malnourished, at risk of malnourishment or undernutrition, or who are obese. It also includes management guidelines which can be used to develop a care plan. There are 5 steps in the MUST tool. They are: Step 1, measure the height and weight to get a BMI. Step 2, note the percentage of unplanned weight loss in the resident and the associated score. Step 3, establish the acute disease effect and the associated score. Step 4, add the scores together to obtain an overall risk of malnutrition. Step 5, use the management guidelines and/or the local policy in place to develop a care plan. Refer to the resource section below this video for links to more information and access to both the screening tools discussed here. While both the MNASF and the MUST tool are valid tools to screen for malnutrition, there are a few differences between them and it is important to understand what they are. Both tools are simple to use and offer predictive validity with regards to mortality. The MNASF is validated specifically in aged care, while the MUST tool was designed for community settings. The MNA-SF also offers higher specificity, and while both provide basic intervention plans, the MUST tool does not use the higher, healthier BMI range as indicated for older adults, so a BMI of 22 to 27 as opposed to 20 to 25. In addition, the MNA-SF makes a full assessment available and is more likely to identify malnutrition risk at an early stage. You can download a mobile app to do the MNA-SF screening, and an online calculator is available for the MUST tool. With all of this in mind, both are valid screening tools and have their pros and cons, although we do recommend the MNA-SF for use in aged care facilities due to it being specifically validated in aged care, and it has the increased likelihood of identifying poor nutrition at an earlier stage. Regardless of their score in the nutrition screening tools, all residents in care facilities should have a nutrition care plan. For people identified as having nutritional risk or being malnourished, the nutrition and hydration care plan needs to be reviewed regularly to identify what is and isn't working, and to identify strategies or interventions to treat or prevent further nutritional status decline. A standard care plan usually includes 3 meals and 3 snacks a day, made up of fortified food and fluids, which the individual is known to enjoy. Standard care plans should also meet hydration requirements by incorporating fortified fluids at a safe thickness. It's important to note that specialized care plans based on a comprehensive assessment will need to be developed by a qualified dietitian for people who are malnourished or who are at risk. If you are unsure about how to find a dietitian, refer to the section below this video for links to valuable resources. Let's look at examples of a diet plan. This specific plan is for a resident with dysphagia who requires a puree texture. A good care plan will ensure that protein requirements are met and that foods providing protein are spread out evenly across the day. It's also important to have a high protein snack before bedtime to ensure minimal loss of muscle mass and strength through the overnight fast. Spreading protein across the day will also ensure maximum absorption for that individual, so their dietary protein can be used as effectively as possible by the body. Any person who is on a special diet, for example low fat, diabetic, or low sodium, should have their needs for this diet reviewed by the facility GP or a dietitian. Restrictive diets can be detrimental to overall health in older age, and may need to be revised to ensure they will not place the resident at risk of malnutrition. People may have been on a specific diet for a number of years without review, so it's important to be cautious with restrictive diets. The focus for any dietary intervention should be on practical, achievable strategies focusing on familiar foods. There is evidence to recommend the use of oral nutritional supplements, or ONS, to improve nutritional status in some patients or residents. Older people with malnutrition or at risk of malnutrition with chronic conditions may be offered oral nutritional supplements, but only when dietary counseling and food fortification are not sufficient to increase dietary intake and reach nutritional goals. Fortified food and fluids, such as milkshakes and smoothies, should be tried first, and prescribing oral nutritional supplements should only be considered if these interventions are not helping the resident meet their nutritional goals as laid out by the dietitian. Trying food-based interventions first is important for a number of reasons. Firstly, the impact of supplementation is not always fully understood, and food is more familiar and usually more accepted by the residents and supportive of quality of life. If fortified foods did not improve the patient's condition, oral nutritional supplements should be tried for a month only, followed by a review. Oral nutritional supplements are not recommended as a way of improving cognitive impairment or preventing further cognitive decline. That brings us to the end of the first section in this advanced nutrition care video. You have learned everything you need to know to successfully complete the first quiz.